Hi, my name is Jennifer Shiflett. I'm a physiotherapist specializing in concussion and vestibular or inner ear rehabilitation. The purpose of this video is to discuss concussions and the importance of vestibular rehabilitation in improving symptoms that one may experience following a concussion. Symptoms predominantly addressed in vestibular rehab are, but not limited to, dizziness, unsteadiness, nausea, blurred vision, difficulty reading, writing, are focusing on objects. Most individuals recover from a concussion within 7 to 10 days. For individuals that do not recover from a concussion within this 7 to 10 day period, usually require further assistance, and that's where vestibular rehab or concussion rehab is often utilized. Most individuals I see in physiotherapy are symptom-free at rest. However, a reproduction of symptoms happens, such as dizziness, blurred vision, headaches, nausea, with activities that require input and output from our body systems that are responsible for balance and gaze stability. These symptom-provoking activities can include anything from walking, running, navigating through crowded areas, reading, writing, focusing on objects while moving. So to better understand vestibular rehabilitation and how it can help, just first a little bit about the balance systems that are affected and that we address in vestibular rehab. So to maintain balance, we receive information from three sensory systems in our body. They are our visual system, our somatosensory system, and our vestibular system, which is our inner ear. So a little bit about the visual system. Obviously it helps us see, it helps us move our eyes, track objects, receive information about objects as they move towards us and away from us. This system is very important during slow movements. We can assess the system in vestibular rehab by watching an individual track an object, jump in between objects, as well as track an object as it comes closer or farther away from them. Dysfunction in this system can cause blurred vision, double vision, difficulty reading, writing, and overall dizziness. The next system, the somatosensory system. This sends messages to our brain about our body's position relative to the surface that we're standing or sitting upon. More dominant when we are on firm surfaces. It's usually not affected during a concussion. And then the final system is our vestibular, or our inner ear. This system is responsible for telling our brain where we are in space. It also helps us keep objects still while our head is moving. This is via the vestibular ocular motor reflex. It also helps coordinate strategies for our balance, to maintain our balance, and this is called the vestibular spinal reflex. This is why the vestibular system is so important during return to play, just walking in more dynamic movement. So at the brain level, the input from all three of these systems are processed, strategies are developed, and an outgoing command is given to our eyes and our bodies to assist us in stabilizing our gaze and balance respectively. Therefore, in vestibular rehab, we can get pertinent information of the systems, of the function of these systems by assessing an individual's movement, eye movements, balance strategies, etc. It's also important to have a musculoskeletal screen performed with a focus on the neck joints and receptors feed information into our brains for balance. This can be dysfunctional status post a concussion, such as like a whiplash or head injury, therefore should be addressed and not ignored. So now let's talk about symptoms following a concussion, possible causes, and treatments. First, let's address blurred vision, double vision, difficulty focusing. As stated before, the visual or oculomotor system provides us with our ability to see, but it also helps us track objects called smooth pursuit, jump back and forth between objects called saccades, as well as keep objects in focus while they're coming towards us and away from us, which is called convergence and divergence. A common finding when evaluating an individual who has sustained a concussion is something called convergence insufficiency. This is the inability that eyes proportionally and sequentially migrate inwards in order to maintain focus on objects at closer ranges to them. Dysfunction here often leads to complaints of blurred vision, double vision, eye strain, headaches, difficulty focusing, especially when reading or writing, something that's closer to them. One way to test this is by taking a pen or pencil and having an individual focus on a letter or some kind of focal point on the pen, starting with the pen farther out. So say I'm going to focus on the R on this pen, start with it out, so like at an arm's length, and then have the individual bring the pen in close to them. And then you want the individual to tell you when the R gets blurred or it's double. The normal convergence or near point convergence should be about 4 to 6 centimeters away from the nose or the eyes. And with dysfunction, I see it anywhere is non-existent or anywhere from 20 centimeters out. To improve this, I have my patients begin with pencil push-ups. So for this exercise, you start with a pencil at arm's length, bring it in to where it gets blurry, and once you find that point, then you want to back the pen up and then start bringing it in near that point of blurriness. You can attempt to try this for a minute or until your symptoms are present. It is essential that you don't exacerbate the symptoms during these tasks. So the symptoms, if they're present, you can try to complete the exercise, but then you must rest before going on to start another rep of the exercise. You want to make sure that the symptoms have resolved. You don't want to overtax the system. So if I was doing the pencil push-ups, I would again focus on my R, start with it out, bring it in, and just find that point where the R gets double. I'm just going to say here, and then I'm going to start bringing it out and then bringing it in just like that, and really working on it. On the end point, you want to hold that for around 3 seconds and try to get that convergence down. Another thing that I do is refocusing. So have an individual do that same thing where they're coming in, finding that blurred point, backing up just a bit, and then focusing there, and then focusing on something out in the periphery. So if you're focusing on the R here, then the environment in the back is going to be blurry, and then you're going to switch your eyes to focusing on something farther away, and then the pen's going to be blurry. Kind of a combination of convergence and divergence. Okay, so Brock string exercises is another great exercise for this, working on the convergence and divergence, which we do every day in life, looking at something closer and then refocusing to something farther away. I'll send a video link to this below, or you can see it on YouTube as well. There's plenty of YouTube videos. So next, let's just talk about overall dizziness. So dizziness is a very common symptom following concussion. It's important to identify your dizziness because dizziness can mean a lot of different things to a lot of different people. So dizziness that is room spinning is more related to vertigo. If the room spinning lasts for small bouts of time and only happens with certain movements, like rolling over in bed, getting up from a lying position, looking up, looking down, this can be related more to a condition called benign paroxysmal positional vertigo. This is secondary to these little carbonated crystals in the inner ear that become dislodged from its normal resting place. It can be treated easily in vestibular rehab with simple position maneuvers. But if the dizziness comes from an inability to keep objects in focus when you're moving, it can be a dysfunction in the vestibular oculomotor reflex. So we talked about this earlier, and as described earlier, it's responsible for keeping everything in focus when your head is moving. For example, if you're walking and you turn your head to the right for some reason, then the VOR will make moves and try to turn your eyes to the left to keep that image that you were looking at straight ahead in focus and stabilized. This reflex is active in more faster movements, more dynamic movements, when looking around and maintaining objects and focusing while running or walking. This is why we see this a lot with athletes trying to get back into the game of, like, say it's a football player trying to run and look and catch the ball, things like that. We can test this a number of different ways. The best two tests that I've seen are the head thrust test and the dynamic visual acuity test. The dynamic visual acuity test involves having an individual read the lowest line that they can on a visual acuity eye chart, like a typical eye chart, and then read it again while you're shaking their head at a certain cadence, and ask them just to read the lowest line they can accurately. A jump of one line is pretty normal. However, a jump of 2 or 3 lines is a sign of a VOR or vestibular ocular So to improve the VOR function, I have a patient take a piece of paper, a dot on the piece of paper, and then place it on the wall. I would place it on the wall rather than holding it, for the fact that if you're shaky or unsteady, it just becomes a little bit more difficult. So you're going to focus on the dot and then shake your head side to side. The dot should stay perfectly still and not move. You want to start at a speed where the dot is not moving. If you find that you're going a little bit faster and the dot is moving, then you need to stop and go just a little bit slower. So try for 15, 30-second reps and then build up to bouts of about a minute. And then you can improve in the speed that you're doing it. If you get dizzy, try to finish the set if the symptoms are not too bad, and then rest. You want any symptoms of dizziness, blurred vision to subside before returning to the next repetition. Do not keep returning to the set if you're still having symptoms. Symptoms should be 0 at rest. Again, make sure the dot does not move during the exercise. If it is, your VOR is not there at that level yet, and you need to slow down a bit. Over a few days, you should see an improvement in the speed that you can do and the longevity, and a decrease in the symptom reproduction. Note, you can get dizzy with these exercises, and that is why it's important to take breaks and really get your symptoms down to 0. If you don't take breaks, you're not doing yourself a favor, because you're overtaxing the brain. It can be possible to even set yourself back in your rehab. So your ability to do these exercises should get better and better. Your brain is able to recognize the error and then make corrections to improve it. So I also want to test the balance and how well the brain is able to integrate the information from all of the systems in order to maintain balance. I often use the modified sit-sib test. This test can be easily replicated at home. If you don't have an Airx, which is the foam that is usually used, you can use a thick foam pillow. So the modified sit-sib is performed with the eyes open and closed on a firm surface, and then again eyes open and closed on a foam surface. There's dysfunction in the vestibular system. I often see individuals do pretty poorly on the foam surface with the eyes closed, because the vestibular system is more the dominant system during that task. So to improve this, I simply have a patient start to perform some of the balance tests that they're having trouble with at home. Have them do it for about 30-second increments or try, and then go from there. Secondary to the vulnerable state of the brain after concussion, these exercises must be performed in a controlled manner, meaning that if symptoms are present, attempt to finish the task, but then take a break. Wait for your symptoms to subside before returning to the next task or the next exercise. Reflex dysfunction. So for the modified sit-sib, I usually start with the patient on both feet, just here, and standing on a firm surface. Try it with eyes open. Try it for 30 seconds, and then eyes closed. And then they can progress to going here, and starting here, eyes open, holding it for 30 seconds, and then trying for eyes closed. So make sure to have someone around when you're doing this test, because if you do have a dysfunction in one of the balance systems, you could fall over and not even recognize that you're falling over, especially if you have a dysfunction in the vestibular system. When I do have patients do this for home, and start with just trying to help integrate these systems, I usually have them in front of a kitchen counter somewhere safe, where they can just hover their hands over the kitchen counter. That way, in case they have that there to grab on, whether it's going to be on a firm surface or on a foam pillow.